Everybody, my name's Jenny Pearson. I'm an Education Officer for the Primary Health Network. Before we go any further, I'd like to acknowledge the traditional custodians of the land that we're meeting on today and pay respect to elders past, present and emerging. Just going to turn off the transcription because we don't need that. Welcome to our webinar on Allied Health Digital Maturity Assessment. If you have any questions today, if you can just go to the hand icon, I'll just show you what that looks like. Just raise your hand, and because we don't have huge numbers, we can all just ask questions as we're going. I think will be much easier. You can type them in the chat box if that's what you feel more comfortable with, but if not, please just raise your hand. I'll say your name and then you can ask whatever questions you would like. I'm just going to hand over to Jo Coots, our Integrated Health Manager, and I'll see you at the end of the session. Thank you.
Hello, everyone. Thank you, Jenny. I'd also like to acknowledge I'm on Aboriginal lands. I'm on the Kamilaroi lands in the New England area. Thank you for attending. I'll be very brief and then we'll open up and I'll hand over to Elise from Semantic Consulting, who the PHN have engaged to undertake the survey. So this is just a very quick introduction as to the purpose as to why we're doing this digital health maturity assessment. So the PHN supports digital and data, and there's actually a digital health a digital health strategy. And I've just got the aim up there, which is to deliver improved health outcomes through strong digital health foundations that lead to accessible, equitable, safe, effective and sustainably digitally enabled models of care. So we do know that there's a large disparity of maturity across the PHN footprint. So there's also a large number of allied health practices that are solo and are doing everything themselves, in particular in the regional and remote areas. Not everybody uses the electronic notes. There's different usage of health pathways and access to information. And then also in terms of e-referrals in the Hunter New England area, and use of, say, medical objects to transfer in safe information across the region. And most allied health professionals can't link to GP management systems as well. So really, in the PHN, there's been a digital health maturity assessment for the general practice area, residential aged care facilities and some Aboriginal medical services. So now it's really the allied health turn, and we'll be able to in future look at all of that data together to get a better picture of the digital maturity across the whole primary care sector. Next slide, please, Jo. So really, what we're really asking, I suppose, is for allied health to provide some time in your insights. So completing the survey by the 14th of April. So it'll probably take about 20 minutes. At the end of the survey, you can download your answers so you can keep a copy of that yourself. The PHN will look at the data in late May, June, and then on the 14th of June, we do have a webinar that's set up, and we'll be delivering some of the early results of a high-level analysis at that webinar, and we'll also announce the winner of the $1,000 IT voucher for all of whoever that lucky winner is from the allied health providers that have completed the survey. Following that, we'll complete a more detailed analysis and what that means, and we'll try and align that to both the strategic plan for the PHN, but also the specific allied health strategy that the PHN is leading. So that's, that's really it. You can get in touch with us, but I will, before I hand over to Elise, I just thought I'd pause if anybody has any questions. No? Okay. Elise, I'll hand over to you.
Yeah, wonderful. Thanks, Jo. So as Jo said, my name's Elise, Human Manager at Semantic Consulting. Been working really closely with the team at the PHN to develop and implement the Healthy Together Digital Care Survey. What I'm going to do now is just give you a really quick feel of what the survey looks like, and again, answer any questions as we go. So you would have received an email from Notifications at Kaleidoscope with a link to the survey. If you haven't received that, please reach out to the PHN and they will get in contact with us and we can resend that to you. Within that email is a link to click on. So once you click on the link, I'm just going to share my screen now and show you what it looks like. Before I do that, have either Michael, Andrew, or anyone else on the line looked at the survey, had a play with it yet? Have you received the email notification? Great, fantastic. Okay, so I'm going to share my screen with you now. Just want to make sure, can you see that okay? It's not too small? Beautiful, yes. Thank you.
It's a bit small.
What's that, sorry, Jo?
It might be a bit small. Is that okay, Michael?
Is that a bit bigger?
Yeah, come off by the microphone. Michael's just got his hand up.
Yeah, absolutely. Go for it.
You're on mute. Sorry, Michael.
Am I right to keep going? Not sure whether Michael had a question.
It's too small.
Oh, okay. No worries. How's that?
Yeah, that's better. Thank you.
Wonderful. So when you click on, and apologies, I'm unable to see the chat while I'm presenting. So if someone can jump on and just let me know if anyone asks questions, that'd be wonderful. So when you open the link, this will be what you will see. So this is ultimately the consent form. So you're consenting to participating in the survey. It will ask you to put your name in, so pop your name in. It could be pre-populated. If it's incorrect, please feel free to correct it, and it will also auto-populate the date for you as well. It will ask you to consent. So if you've read the consent and you're happy, you simply click yes. If by any means you are unsure, we do encourage you to reach out to the PHN to discuss your concerns. When you do that, if you feel you're still uncomfortable, just select no, and it will go all the way down and you can complete your survey. Obviously, for the sake of the webinar today, we're going to say yes, that we consent to participating in the survey rather. Then we pop in your practice name, so the name in which your patients are most familiar with. I'm just going to simply call myself Test for the time being. And we get you to select the region in which your allied health practice operates in. And for the purpose of this, I'm simply going to select Newcastle. And I'm going to go to next. So you'll be asked a series of questions within a number of different themes. Now, this survey is designed to be completed within about 15 or 20 minutes. There are questions in there which you may not be familiar with, and that is okay. We don't expect you to have to go off and spend hours researching your responses. You should be able to complete it. There are some questions in there around, say, SNOMED coding, for example. If you're unsure around what that is, the question is around awareness. If you're unsure what that is, please feel free to say that you disagree, that you're aware. And this is the purpose of the survey, is to help the PHN identify where there could be some opportunities for education, for skill development moving forward. So you'll have a series of tick the box questions. There will be some questions that open up into a drop down box to enable you to write some free text. There will also be a Likert scale questions as well. So from, strongly agree right down to strongly disagree. As I said, roughly between 15 and 20 minutes to complete the survey. For the sake of time, I won't go through any more of the survey. So that's ultimately it. Is there any questions? We feeling comfortable? Okay. Heckles, comments? Go for it.
I had a crack at it earlier, just before I came on, Elise. So it was all fine about that 20-minute mark. So yeah, no, it was all good, except for that question you brought up, which was a disagree. So yeah, didn't know too much about the SNOMED, but
yeah, and that's completely okay, Andrew. And there's no judgment here by obviously us or at the PHN. It's really just to understand where people are at.
Yep. No,
Great.
it's really, really good. And yeah, questions. I sat down with my practice manager and we ripped through it. So it was good. Thank you.
Fantastic. Thanks. Great feedback. Thank you, Andrew. Michael, have you had a chance to have a look at it by any means? Oh, sorry, you're on mute. Sorry.
Am I unmuted now?
Yeah, you're good to go. Yeah.
No, I haven't looked at it yet. I just thought I thought I'd do this quick webinar thing with you first and then have a crack at it. So yeah.
Great. Feeling confident?
Oh, I don't know. I'll have a go. Doesn't sound too hard.
Yeah, look, have a go. If you need to reach out to the PHN, they're there to help you along the way.
Okay. No worries.
Wonderful.
Yeah.
Great.
Thanks.
More than welcome. Any other questions? Great. Well, a short meeting is a good meeting in my books. So, Joe, if you're happy to close, I think we can.
Yeah, no, it was just an opportunity to ask any questions that you may have had. But yeah, Michael, please reach out for us. I think it's just the alliedhealth@thphn.com.au, or give us a call and ask to speak to Joe or Joe, and we'll get back to you.
How do I reach out? Sorry.
Either you could call me direct on 0427 299 632, or Joe Dean's just put in the email address in the chat.
Okay. Yep.
Great. Short and sweet. Lovely. All right, I'm just going to stop recording.